Mike Evans of the Tampa Bay Buccaneers was initially questionable to return in today's matchup against the New York Jets, and then he was downgraded to being out officially for the remainder of the game. Sources have come out and said that he is officially dealing with a hamstring injury, and as of right now, we do not know the exact severity of this. The hamstring is a group of 3 muscles that are located in the back or posterior portion of the thigh, and there are several risk factors that put somebody at risk for a hamstring injury. With today's video, I want to go over the specific muscles of the hamstring, and I also want to talk about some mechanisms that can lead to somebody developing any sort of hamstring strain, and we'll also go over the best and worst case scenarios by looking at the grading system. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy, and with my channel I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I'll also go over the relevant anatomy for that injury as well as talk about the rehab process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a hamstring injury, go ahead and comment in the comment section below. We see here on the injury replay that as Evans is going to run a route, he's going to cut inwards. When he does this, we see him be in noticeable pain and he hops on his right foot, favoring that left leg. Now let's go ahead and go over the 3 muscles that make up the hamstring. The first one is known as the biceps femoris muscle, and this is actually going to have a short and a long head. This muscle is actually located laterally or towards the outside portion of the thigh. As we make ourselves medial, there is the semitendinosus muscle, which is going to be the most superficial one, and right below that is a muscle known as the semimembranosus muscle. These muscles are located more medially or towards the inside portion of the thigh. All 3 hamstring muscles actually have a common origin on a bony prominence, and that is known as the ischial tuberosity, which is on the bottom portion of the pelvis here. We also refer to this as being the sit bones. The insertion point is going to differ for these muscles, so the biceps femoris, for example, because it is more lateral or located to the outside, it's actually going to cross the knee joint and it's going to attach itself onto the tibia. And then the semitendinosus and semimembranosus, because they are more medial, they're going to come down, also crossing the knee joint and attach themselves to the medial portion here of the tibia. Because of the muscle's attachment point, they are going to play a major role in flexion of the knee. So anytime we bend the knee, we are contracting the hamstring muscles, and anytime we are doing the opposite, where we are straightening the knee, that is going to stretch the hamstring muscles. And because it crosses the hip joint, it also has function there too. So when we are extending the hip, this is done by predominantly the glute muscle, which is the major extensor of the hip, but the hamstring muscle will also play a role when it is activated in extending the hip, and vice versa. When the hip is in flexion or we are bringing the knee up in front of us, that is also going to stretch the hamstring muscle. As of right now, we do not know the specific muscle that Mike Evans has injured when it comes to this hamstring injury, and very rarely will they specify the particular muscle. However, it's important to know that when it comes to hamstring injuries, the most common muscle injured is the biceps femoris. This is because during activities such as sprinting or jumping, the biceps femoris is actually contracting while lengthening. So it looks just like this. As we are running, that bottom leg is going to straighten. As that biceps femoris is lengthening, it's also simultaneously contracting, which will put it at greater risk for injury. There are several risk factors that can increase our chances of having a hamstring injury. Unfortunately, with age, as we get older, the chance of hamstring injury is going to increase every year. A previous history of hamstring injuries can also lead to future hamstring injuries, as well as certain muscle imbalances. We know that in this particular case, unfortunately, Mike Evans has been plagued with various hamstring injuries throughout his career. And because he is an older player in the NFL, these 2 risk factors together are going to put him at greater risk. In the clinical setting, if we get somebody that has a suspected hamstring injury, basically what we're going to do is we are going to put that person prone on a table, and we are going to see if they are able to bend their leg. In this position, what we're going to do is we're going to tell them to resist, and we're going to try to pull that bottom leg away. If this is going to reproduce pain and or weakness, then we think that the person has suffered a hamstring injury. Also, what we're going to do is we can differentiate between which muscles we think are involved. So, for example, if we think that it is the biceps femoris, what we are going to do is we're going to have them prone and we're going to pull back in a diagonal way away from the biceps femoris. If this elicits more pain and the pain is located more on the lateral portion of the thigh, it makes us think that muscle is being affected. And then we will do the opposite. So if we want to test the semitendinosus and or the membranosus, what we're going to do is we are going to put them in that prone position, pull at a diagonal away from those two muscles, and see if this is going to elicit pain more medially. We are also going to be palpating the affected area, so we're going to feel along that musculature, whether it be the medial or lateral muscles. And what we're feeling for is we're seeing if we get any sort of reproduction of pain or if we see any knotting or any bunching up of the affected muscle. So we can do those sorts of things if we suspect a hamstring injury, but to get the official scale or the severity of the injury, the person is going to need to have an MRI, and this is where we will get into the grading system. So if you've watched some of my videos in the past, typically the grading scale is grades 1, 2, and 3 for muscle injuries. In a grade 1, you're getting stretching, maybe some micro tearing of the affected muscle. In a grade 2, you're getting significantly more muscle tearing, but this is considered a partial tear. And finally, in a grade 3, this is the worst case scenario, and you're going to be getting a full rupture. In a grade 1 hamstring injury, this is considered mild, and the person is not usually going to be limited in their daily function. This can take anywhere from about 1 to 2 weeks to fully recover. In a grade 2, this will be considered moderate. A person is going to be limited in their daily function. This can take anywhere from about 2 to 6 weeks to reach full recovery. And finally, in a grade 3, they will be severely limited in their daily function. This is considered a severe hamstring injury. It can take anywhere from about 6 to 12 weeks and usually is going to require surgery. So to determine an accurate timeline for him to return to come back fully for the NFL season, we'll need to see the results of the official MRI. So hopefully we get that sometime soon. But if you do happen to suffer a hamstring injury or you happen to get that in the clinic, what we're going to do initially is we're going to follow that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. We do this during the inflammatory phase. Then once the person gets out of this, we can start to work in gentle range of motion and finally work in strengthening when appropriate. Treatment, of course, is also going to be dictated depending on the severity scale of the injury. So once again, we'll wait and we'll see how severe this injury is. It looks like he seemed to limp quite a bit as he was walking off of the field. So we hope it's more along the lines of a low grade strain, and of course not one of those grade 3s. If I happen to hear any updates, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the other injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.